Hi everyone, my name is Patrick, a nursing student at Central Queensland University. Today I'll be discussing the promotion of personal recovery in patients following acute deterioration in the aged care setting. Acute deterioration is a common occurrence in aged care. Examples may include strokes, cardiac arrest, and falls resulting in injuries. Accumulating evidence indicates the beneficial rehabilitative effects of positive emotion on health and recovery in older age. The three studies on this slide examined the association between positive emotion at discharge from inpatient medical rehabilitation centers and the effectiveness of the treatments. The studies identified positive trends between a good outlook, motivation to get better, and effective rehabilitation. This is believed to be because the patient remained determined, had a positive attitude, and received social and emotional support throughout recovery. This in turn promotes the active participation of rehabilitation. The support regarding the emotional recovery following acute deterioration in aged care is often overshadowed by the clinical recovery. For this reason, we'll be discussing methods of promoting personal recovery in the patient's post-acute deterioration. A helpful framework for personal recovery I would like to utilize is the CHIME framework by Leamy and colleagues. Feel free to pause the video and read through the different concepts of the CHIME framework. From this point on, we're going to be relating the CHIME framework to an aged care setting when considering post-acute deterioration. Connectedness. Ensuring the patient is supported by their peers by promoting the active participation within social activities they enjoy. Ensuring the patient is supported when maintaining relationships with their peers, friends, and family. Supporting the patient through emotional support during recovery. Encouraging family and friends to visit the patient where appropriate. Hope and optimism. It's important to instill positive thinking and values into the patient regarding their recovery. We're to encourage the patient to create goals and assist them in achieving these goals. We're to inspire the patient to have a positive recovery through reassurance and positive affirmation throughout. Identity. We must reassure the patient that their illness does not define them and encourage them to remain positive. Meaning. So it's very important to reassure the patient that their illness does not make their life less meaningful. We're to promote them in their social roles, within their peers and family groups, with encouragement and positive affirmation. Empowerment. We're to remind the patient of their self-importance and promote personal responsibility. Promote the patient to take control over their life and their illness. Promote the patient to focus on their strengths and enable their recovery. So some limitations and considerations to be made. Sometimes the family of the patient may not always be in the position to visit. In this case, we have to ensure that the patient still receives the social and emotional support they require. Family and also the patient may require education, affirmation, and reassurance regarding their loved one's illness. Patients may not always be able to attend social activities at the capacity they could in the past. As aged care workers, we must encourage the patient to attend in any capacity they feel comfortable. Patients may not always be able to communicate effectively due to their illness. Passive participation in activities may still be an option if the patient chooses. Thank you very much for listening, everyone.